I wonder if the government wizard likes Red Bull too. Product placement.
I can't believe I survived.
Okay, so it's important that we start to look at the differences in the ways that different political parties address governance by looking at some concrete examples. So we're going to start off with prisons, okay? And when we talked about liberals and we talked about conservatives and how they view prisons, right, it was very clear that there's two different ways that the sides view criminality, right? On the right, on the conservative side, they view criminals as people who have willingly made bad choices and deserve to be punished for those choices. On the left, they tend to see people as being victims of a system, whether that system be poverty or racism, but then their decisions are bad. Don't get me wrong, the left still thinks that they're bad, but they think that there's an ability to change the outcome if we change the systems, right? So if someone is committing a crime, let's give them education, right? Because if they have schooling, maybe they won't commit crimes anymore, right? So that's just like one of the key differences, right? And that's going to impact how the real world works. Take coronavirus, for example. Right now, prisons are becoming huge hotspots for the coronavirus, right? So coronavirus is brand new. No one was prepared for this. But one of the things that's very true about it, aside from it being new and not having a cure for it, it spreads incredibly quickly. And it's kind of a silent killer because you could have the disease and not know it for weeks and still spread it to other people. It's called shedding, right? You could be putting out some of the virus for almost 2 weeks sometimes without you even knowing you have it to begin with, right? You may be asymptomatic, which means you have no symptoms at all throughout the whole course of the disease. So in prisons, it's being particularly hard hit because they are small, confined places. Now on the right, the general consensus is, well, pay the crime, do the time. If you get coronavirus, you shouldn't have committed the crime in the first place. There are currently over 2.3 million adults locked up in prisons right now, which is by far the highest number of prisoners we've ever had throughout our history as a country, right? One of the things that's particularly sad is that we also have over 85,000 youth locked up at present, right? All of these people are at higher risk of catching the disease because of their close proximity to other people in the same situation. Not only does this not take into account the fact that most of the people that are in prison are there for non-violent crimes, right? They also, up to 90 to 95% of the people in prisons are going to be released at some point in time, right? That's not like it's a life sentence for, stealing paper clips, right? But also, one of the things that people aren't taking into account when they say this is, the only people in prisons aren't just prisoners, right? You have nurses, you have guards, right? You have administrative staff, right? These people are going in and out of these places. And what happens in the prison is you have people in close quarters sharing these spaces. It's like party time for the disease, right? And these people going in and out are now not only getting it in the prison, they're taking it back out into the communities, and it's becoming a potential threat for everybody, right? So take a look. I'm gonna kick you over to a video right now, right? This video is coming from MSNBC, right? And if you remember your cool little political bias chart that I made you look at last week, MSNBC is on the political left, so everything you're about to see over the next couple minutes is coming from the perspective of people on the left. You're going to watch an anchor. His name is Chris Hayes. He's way smarter than I am, and he's going to be having a conversation with someone about what's going on in the prisons. When the video is over, just answer the questions in the document below, okay? Cool. Good luck.
As we've reported here previously, one of the worst places to be during this pandemic is locked up inside a prison or jail. In state, local, and federal detention facilities around the country, the same horror story is emerging of the unchecked spread of infection and inmates essentially being left to die. Inside one federal facility in Ohio, where at least 3 prisoners have been killed by the virus, one inmate with a smuggled smartphone recorded a plea for help.
It was all good like a couple days ago, right? So, all of a sudden, out of the blue, everybody just dying. getting sick and like this serious as like they literally leaving us in here to die. Y'all can social distance. We can't social distance.
You can social distance, he says. We cannot social distance in prison. In the latest episode of his MSNBC podcast, Into America, Trymaine Lee takes a look at what's being done to protect the people who live and work inside these facilities.
The fear is real. That's all. You like, prison is a place where, like, when there's tension, you can feel the tension in the air. You can feel the fear in the air. When you walk around, it's thick. It's thick.
Joining me now is MSNBC correspondent Trymaine Lee. Trymaine, you talked to family members of those incarcerated, including people who are incarcerated. What did you hear?
I'll tell you what, Chris, as the virus continues to spread across the country, so is the fear, not just of the folks inside of those facilities, but the families who essentially are serving time with them. Now, JJ Velasquez, the man we heard that clip of, he says that you can feel the tension and it's so thick in the air, but also that if folks on the outside can't get access to testing and proper health care and masks and protective gear, what makes you think anyone would care about those on the inside of prisons? Now, we know all of us on the outside who are social distancing, creating space between ourselves and other people, they don't have that option. They're living in close quarters. The inmate population is the most vulnerable population in America to disease. They're more prone to getting hepatitis and tuberculosis. But also, let's not forget, we can kind of keep them in their cells, on their blocks. But every single day, staff and corrections officers are coming in and out of the prison. So one of the main carriers of COVID-19 into the system are actually those who work inside the building, not just the inmates.
Yeah, and that's, I mean, we've made this point before, but you're seeing it now. This is a perfect example. There's 492 cases in Cook County Jail in Chicago, 2 deaths. And if I'm not mistaken, I think about half of those, a little more than half of those are inmates, and about 200 are correction officials and others employees of the sheriffs. It's not gonna stay there, even if you don't care about the, moral worth of people behind bars, which you should. The disease is not going to stay there. There's people moving in and out.
Chris, I'll tell you what is almost mind-boggling, but not really, because this is America and this is who we are. The Into America podcast dropped last night at 5 p.m. I tweeted about it. And if you check my mention, people were saying they committed a crime. They deserve to be there. Do you want to let them out and rape and murder? Send them to democratically run cities. Never take into account that there are people who are working in these facilities who will be coming out into the community day in, day out, visiting with their family members,
right,
who will then spread the virus. But also 95% of inmates currently, the 2.3 million people, of the 2.3 million trapped behind bars, 95% will at some point get out. So we're talking about this disease. It's behooves all of us and the power to structure to really make sure that we're taking care of those folks. If not, we'll all be paying the price for a very long time.
And also to that point, I mean, obviously there's a huge concern in a lot of cities are jails, right? So there's prisons where people are serving longer sentences. Jails, there's huge turnover in those populations. One of the people that died in Rikers, contracted the disease, was there for a minor parole violation, caught the virus, and then passed away. This is someone whose pre-trial was on a minor parole violation, and there are jails where people are cycling in and out throughout the entire country.
I mean, that's obscene and tough on many levels. One, not that it matters whether you're innocent or guilty. If you're in the charge of the state, you should be taken care of. But could you imagine being accused of a crime, landing in jail, and then not being protected and dying before you even had your day in court? But across the country, some state prison systems are trying to make sure that they limit the number of people who are transferred from the jail system into the state system. So in Colorado, where I spoke to the executive director of the Department of Corrections, Dean Williams, he said they tried to limit that transfer of inmates, but their first positive COVID case this week was an inmate transferred from the Denver City Jail into the state prison system. So it's layered, it's tricky, and it's all around bad.
Yeah, once it's in there, it's hard. Trymaine Lee, thank you so much for joining us tonight. Joining me now is Jeffrey Sachs, director of Columbia University.